So let's kind of break this down and talk a little bit about the application here. So say, for example, you've got low and high intensities. Like how do you put that into your... How do you put that into a 45-minute or 50-minute session?
Okay.
Are you putting people on a mat and massaging them on top? Are you applying it to certain areas of the body? How does that look?
Oh, okay. The reason that's such a broad question for me to answer is because it is genuinely so bespoke.
Okay.
So we draw on all the resources and we decide what we're going to do with each client depending on what we're dealing with. But I can talk you through how we would generally look at doing that. So because we're in a clinic environment, we like to be using, like you said earlier, there's no point in people using lower intensities once a week because they're not going to get the results. I always say any PEMF is better than none. But what we would do is we've got high intensity devices. So we've got a Zimmer MFill Pro, we've got a Hugo device, the sandwiched approach, we've got a Curatron, and between a Curatron 3D, I think it's called 3D 2000s. So, and we also have medium to low intensity devices. So I don't want to leave any out, but we've got the Celerate, which is fantastic. We've got the Biomag, we've got the Flex Pulse, which is absolutely brilliant, especially for sports people. So what I tend to do is we encourage people to do the high intensity stuff in the clinic because you see quicker results, and to then, my hope and my desire in life would be that every household actually has a PEMF device, because I just think it's a phenomenal technology. But I think we're fighting with a difficult culture in the UK because we've been so used to the NHS fixing things. I think I'm starting to see a trend now over the last 15 years where people are taking a lot more responsibility for their own well-being rather than going to the doctor and saying, I've got this problem, can you give me a tablet for it? There's been a real move towards well-being, specifically post-pandemic. So that, I think, is, people are looking into that more, but we will always offer people a PEMF trial of a unit that is less intense to be able to resolve a particular problem that they have. But it is quite difficult for people to change the mindset from coming to a clinic like this proactively. So from actually coming because you're in crisis, you're in pain, you want something dealt with, we deal with the symptoms, and often we'll move into a maintenance program. But for people to then take that step further, that is my hope, that they would be even more proactive. We've had a lot of people that have done that, but it's not the general kind of way of doing it. So come back to answer your question. What we would do, an ideal situation, if appropriate, we'd have somebody on the Hugo, which is the full body sandwich device, before treatment. Because where that's incredible, it's got quite diagnostic in value for us. Because say, for example, if somebody comes and says, I've got pain in my shoulder, with where they're pointing to the pain is not necessarily where the pain is coming from, if it's referred pain. So after a session on the Hugo, we would say to them, where did you feel that more, where was it more uncomfortable for you? And they will point to the area that the pain is originating from. And as a result of that, we can then go in their soft tissue therapy or advanced massage treatment and focus in on that area. And it's always coming from the point that the PEMF identifies, always. So that's one way that we integrate it. And then the other way is with the Zimmer MFill Pro is just a box of miracles. We first bought it. It was a huge investment, bearing in mind people didn't really know at the time what it was all about, but it's been an absolute game changer for us. Absolute game changer, because you get the results so quickly. So with that, both our chartered physiotherapist and myself work with both modalities simultaneously. So we will book a session that includes both advanced massage and the M-field, and we will either where it gets really exciting is when you're trying to put a puzzle together. Somebody comes in with 3 or 4 different things going on, and normally we would say to them, listen, I can only deal with X today. But what we do is we would be working on their neck while the M-field's working on the knee, and then you get them in the different position, and you kind of work with the device. And you can also go in and immediately feel the palpable changes in the muscle. So we do that a lot, where we either use the Hugo in the beginning that identifies the problems, or we would work together with the M-field.
So you mentioned before about the differences between low and high, and your ideal situations when people come in and you're treating them on the higher intensity systems. So lower intensity systems, where do these fit in? Like you've mentioned to me before about getting people to, if they've got the money, to invest in a system for themselves. So is that where you think they're better suited?
Yes. Yes, because you want people to be more proactive. So the kinds of things that I would do with the lower intensity systems, or medium, I think Biomag wouldn't be happy for me to call theirs a low intensity, but in comparison to what else we're using, they're much lower in intensity. But I would say, for example, we're helping someone who's got a knee injury and they've got a very swollen knee and there's inflammation. I would be treating them in clinic and then say to them, hire this device out for 2 weeks or a month and use it every day, and I'll show them exactly what programs to use. But if we could take it beyond that, I think, the benefits of this, it basically slows down the aging process. That's a really big thing, because it's dealing with inflammation. It's just doing so many things physiologically that could help people to prevent illness in the future. So that is my heart, to get to people to understand where they're at and how to go from where they are to where they want to be. And PEMF could be a very, very big part of that. It is a big investment, but I think it's a very worthwhile investment, because you can use it for your aunties, your uncles, your grannies, your kids, your dogs, your cats. Do you know what I mean? It's something that the whole family would benefit from.
Yeah. So ideally they're using that on a daily basis, and then they're coming into you for the higher intensities, something that is going to hit them with higher intensities and have more immediate kind of results and diagnostic results for you guys. So it's kind of like a full package. But in terms of the recovery and preventative going forward, and it's good to see that the shift in health, I think, is changing slowly. Definitely in America, we're seeing this quicker than it is in the UK. But in the UK, the preventative health now, I think, is becoming something that people are starting to take notice of. And if anything, for you, you want the best for your clients, but if they're going to get into preventive health later on down the line, you may not see them again, that's
great, because then we'll see other people. That's great. We don't want the same people coming back for the same problems. We want to be able to. So what we do with our well-being journey is we take them literally on a journey, and there's so many different things we could do to put into their lives along the way. There's education, there's courses, there's all kinds of things, but you want to see people fly. You don't want to see people keep coming back for the same old problem. That's terrible.
Exactly.